Hi, it's a nursing professor here, and during March Madness, we're doing quick 5-minute wrap-ups, and today I'm going to talk to you about high-risk pregnancies. So two of the biggies in high-risk pregnancy is preeclampsia and gestational diabetes. When you hear gestational anything, because sometimes they'll call it gestational hypertension as well, you're basically just saying that it's because of the pregnancy that this person has now been diagnosed with hypertension or gestational diabetes, or just diagnosed with it. It means that they didn't come into the pregnancy having had this disease process already. So gestational diabetes is basically when you're not making enough insulin to keep up with the growing needs of the fetus, or the hormone levels in the placenta is throwing everything off as far as your insulin. This can be a very scary diagnosis for the mom, simply because they hear the big word diabetes and they're scared. This does put them at risk to deliver a baby that's above 9 pounds, which is one of the reasons why you're going to really press a healthy diet. These patients we definitely send to a dietitian, because you want them to have a nutrition plan that works for them. Nutrition plans should be individualized because, different cultures and taking different eating patterns into consideration, that would be the best for the mom. You want to also talk about exercise, because it's really important that this mom gets enough exercise. Brisk walks after they eat can do a world of good for the insulin spike, so that they don't get the spike after they eat. Also, glucose monitoring and all of that is going to be new for them. So it's a lot of knowledge deficit for these new moms. They're usually going to see them more frequently in the clinic, simply because they want to keep an eye on their weight and how the fetus is doing, and that they are following their diet changes. So glucose monitoring, sticking their fingers, all of that kind of stuff is going to become important for this patient. Preeclampsia is new onset hypertension with proteinuria. So these are the moms who again came into the pregnancy, did not have hypertension, but now have had a documented 140/90 blood pressure or higher on 2 different visits. Or if it was like over 160/110, we only need one of those to then give you the diagnosis of preeclampsia along with proteinuria. So the two have to go together to get the diagnosis of preeclampsia. And this is caused by hypertension that's causing your kidneys to not work. So see, the proteinuria is showing you that you have kidney damage. So I shouldn't say that it's not working, but you have so much pressure on the vessels that the protein spills out into the urine, which is what's happening. So this is really a problem. The mom usually has edema, will complain of a headache, brain fog. They also have hypertension, and we talked about the proteinuria that you can see in a dipstick. These moms are we're going to watch them a little closer, and oftentimes they're sent to the ER to rule out, especially if they're complaining of an intense headache. So you might see orders for a CT scan or MRI. They would shield the mom with a CT. Mag sulfate to make sure that they don't seize, because you don't want them to seize. If they seize, it's called eclampsia. You're going to get IV fluids for this mom. Also, they put them in the left lateral position because the fetus will get better circulation in that position. And you want to possibly prepare for labor with preeclampsia. It depends on what's going on with the mom. Of course, you're going to do fetal monitoring, because they want to make sure that the baby is not in distress and is doing well in the environment. They're also going to give corticosteroids, because they are trying to speed up the maturation of the baby's lungs, so that they can do better if they have to deliver them early. So there you go. There's a 5-minute wrap up on 2 of the biggies with high risk pregnancy. There you go.